Hi, my name is Kitnai Poma, and today I'll be performing IV insertion and discontinuing the IV. I have my sharps container, bag, and I have all my supplies right here. IV start kit, saline, and tubing, and my 20 gauge needle as my patient will be getting IV fluid, okay? So I'm gonna go ahead and confirm the MAR, ensure that I have everything, go ahead and confirm the doctor's orders, and do the 6 rights of medication. Right patient, right drug, right time, right dose, right documentation, and right wrap, okay? So now I'm gonna go ahead and go into the patient's room. Knock, knock, knock. Hello, Ms. Poma. My name is Kitnai, and I'll be your nurse today. Closing the curtain for privacy. Today we'll be doing an IV insertion. Can you confirm your full name and date of birth? They confirm their full name and date of birth, and then I'm gonna now proceed with my skills video. So Ms. Poma, today we'll be giving you IV fluids, and I'll be using this 20 gauge needle as she will be getting IV fluids. Do you have any questions, comments, or concerns before we get started? No? Okay, I'm gonna go ahead and get started, okay? So I made sure that the patient's in a comfortable position and they don't have any questions, comments, or concerns. I'm gonna go ahead and prime my IV tubing now. Taking off everything, the caps, tossing it. Getting my saline, taking off the caps, tossing, and tossing. It's important to prime the tubing because we want to ensure that we are not injecting air into the patient. So now I'm gonna go ahead and prime the tubing, and I'm letting water come out. I ensure that there was no more air bubbles, so I'm now clamping the tubing. The tubing is clamped. We're gonna be using that again later. And I ensured that my work area is clean. There's nothing there. I'm gonna toss this. I'm gonna go ahead and put the tourniquet. The tourniquet needs to be above the insertion site, about 4 to 6 inches. I'm gonna be inserting right about here, so I wanna move up a little bit. So I'll be putting the tourniquet right here so I can insert down here, okay? So I'm getting this in now. So I have the tourniquet in, and I now want to feel for a distal pulse because we want to ensure that this is not too tight. All right, so I feel a distal pulse now. Very good. So that ensures that this is not too tight, okay? All right, so now I'm gonna go ahead and get my needle out. There you go. I'm gonna go ahead and get my alcohol prep pad. There you go. I'm gonna wait for that to dry as I get my needle. These are all my last supply of our IV stuff, so I will not be retracting the needle back into here, but I will be putting it in the sharps container because we might have to use this again, okay? So I ensured that the area was dry and we felt a distal pulse. I'm now gonna hold down onto the skin to ensure that the needle's not moving and the veins are not moving. So now I'm gonna insert about 30 degrees as I'm holding on to this. So I'm now inserting the needle about 1 or 2 centimeters first. I don't see a flashback. Okay, now I see a flashback. So now I'm gonna advance the needle all the way. So I'm advancing the needle all the way. There you go. So now I'm gonna hold this, take this out. So I will not be closing this, but I will be keeping this, but this will go in the sharps container, okay? Now I'm gonna get this. Go ahead and attach it. Okay, so I'm gonna go ahead and pull off the tourniquet. I'm gonna unclamp now. I'm now gonna aspirate a little bit. So I'm gonna pull back to see if there's any blood. Okay, there's some blood, so now I'm gonna push forward to flush. There you go. It is now flushed. Now I'm gonna clamp it back again as I do this. So now it's clamped, and I'm still holding on to stabilize. I'm gonna take this off. There you go, it's now off. I'm gonna put this off to the side. I will not be taking this out, but I just want to ensure that I'm gonna initial and date and put the gauge that I put on here, and I'm still stabilizing this. So I will not be putting on the tubing, but I'll be putting it on our cath itself to ensure that if we do have to change the tubing, we can change it out. So now I'm going to put it there as I'm stabilizing it. Okay, so I'm putting the tape on. These are the last of my supplies, so I cannot take it off, just in case I have to do the video again. Alright, so now it is on there and it's not on the extended tubing, and I'm now going to tape this up at the top, okay? I'm taping this up at the top to ensure everything is good, okay? So now that everything is good, I'm going to go ahead and leave the patient's room. Okay, I'll be back, okay? So now that we have everything all set up, I'm going to go ahead and document. The doctor said that they didn't need any IV fluids anymore, so I'm going to go ahead and come back. I'm going to do my hand hygiene again. Okay, Miss Palma, I'm going to go ahead and discontinue your IV, okay? So now I'm going to get all this on, do my hand hygiene. Okay, so now what we're going to do is we're going to stabilize the cath. I'm going to take off the tape here. So I'm taking off the tape, the dressing, and still stabilizing, okay? Then I'm going to take off this tape too. Take off the tape, put it down. And then I'm going to grab a clean gauze so I can hold it here. Okay. Now I'm going to pull off the cath. So I'm still holding so I can put the gauze on top of their site. Okay, I'm going to hold it there for 30 seconds. I'm going to go ahead and inspect the catheter. I'm sure there's about an inch here and it did not lose in its integrity and there's no cracks or kinks, okay? I'm going to go ahead and toss that now. And now I'm going to inspect the patient's skin because I want to make sure that there's no redness or tenderness because I already inspected the cath, so now we want to inspect over here, okay? So now we're just inspecting, looking at it. I'm still holding down a little bit for pressure. I waited 30 seconds and now I'm going to check to see if there's any blood. I don't see any blood. All right, so now I'm going to go ahead and toss this. And what you can do is give them a little band-aid or just another gauze with tape in the event that it does bleed a little bit. But since they're not, we don't have to do that. But for precautions and what I've seen in the hospital, this is what they do. So I'm just going to do a little bit for peace of mind, okay? Okay, Miss Palma, do you have any questions, comments, or concerns? No, they don't have anything. So I threw all my supplies away. I put my sharps in the sharps container, and I ensured that the patient was not bleeding. The integrity of the cath was good. I'm throwing away my gloves, doing my hand sanitizer. Okay, Miss Palma, please let me know if you need anything, okay? I'm going to go ahead and leave the call light next to you. So I left the call light next to them, and now I'm going to go document my procedure. So I already documented that I inserted the IV. You want to document when you discontinue the IV as well. So I'm going to go ahead and go put in my notes and chart that we discontinued the IV and that there was no loss of integrity of the cath and there was no bleeding when you left the room, okay? And that's my skills video.